Good afternoon, and thank you for joining us for our weekly update. I wanted to start off by sending my thoughts to all the families impacted by the troubling report released yesterday from the armed forces on long-term care homes. This report has exposed the deep fractures that exist in our long-term care system. Our seniors deserve better than this. This is a national disgrace and cannot be ignored any longer. And it's not new. Other governments have recognized the issue, but nothing has been done. The time to act is now. Many families who have loved ones in care have known about these issues for some time. And just a little over an hour ago, the Premier announced that the province will be taking control and conducting a rigorous inspection of Camilla Care here in Mississauga. I welcome any additional support and assistance that the province can provide to our homes struggling with the outbreak. I also welcome the Premier's commitment today to establishing an independent commission to investigate the situation in our long-term care homes so that this never happens again. And we need a full review of the care practices at all our long-term care homes, and all governments need to provide the necessary resources to ensure that our loved ones can live with dignity and in a safe and healthy environment. I also want to recognize that it's Paramedic Services Week. We have seen some incredible stories from our Peel paramedics who are going above and beyond during this crisis. You are essential in our healthcare system, and this fight wouldn't be possible without you. So a big thank you to Chief Dundas and his incredible team at Peel Paramedics for all that you do. Today I am joined by Dr. Lawrence Lowe, our Medical Officer of Health here at Peel, Megan Nichols, the Executive Director of the Mississauga Food Bank, and Mohammed Faqih, President and CEO of Paramount Fine Foods. We are now in week 11 of this pandemic, if you can believe it. Much of the province has been seeing over the past week, we are in ebb and flow in many cases. Here in Peel, with 262 new cases reported in just the past 72 hours. In the past week, Peel has accounted for nearly 1/3 of all new cases in the province. As I said last week, and I will say again, we may be done with the COVID virus, but it is not done with us yet. Not only does the virus take up to 2 weeks to present itself, but the CDC estimates roughly 35% of people are asymptomatic. We know a second wave is almost inevitable. There hasn't been a pandemic in world history that hasn't experienced a resurgence. But our goal must be limiting the height and the severity of this second wave and preserving the capacity of our healthcare system. Each and every one of you have sacrificed so much over the past 11 weeks. Please be responsible and do the right thing. Let's not find ourselves back at square one. The warm weather is here to stay, and with that, we know that more people will be out and about. Last weekend, we continue to have our enhanced complement of 182 bylaw enforcement officers working to enforce the emergency orders. Officers use the opportunity to inform and educate over 7,000 residents. It is our hope that this will result in people making better choices moving forward. We saw a concerning rise in tickets over the weekend for house and pool parties and large Fast and Furious style street racing meetups of 75 to 100 people. Over the weekend, our enforcement team undertook a joint operation with Peel Police, which resulted in 87 people being ticketed for gatherings on 2 consecutive nights in the parking lot of a large outdoor mall. Peel Police also issued 67 Highway Traffic Act violations and laid 2 criminal charges in this sting. Please, parking lots are not the new social cafes, and street racing is both reckless and dangerous and costly. In terms of activity in our parks, our waterfront parks were busier than usual. But for the most part, people respected proper physical distancing. We did receive a handful of complaints about large group gatherings, but thankfully, our officers found that most were distancing appropriately. This brings me to an update on our park amenities here in Mississauga. Last week, Council decided to hold off on reopening park amenities listed under the first stage of the province's reopening plan because our numbers didn't support a broader reopening. Over the past week, we've been able to dig a little bit deeper to determine what exactly was causing the increase. The good news is that a number of cases in our long-term care homes and the congregate settings has leveled off significantly. Where we are seeing a spike right now is in household clusters, which means that one person is getting infected in the community and bringing it home to the entire family. Also, with more and more people going back to work, we're starting to see a spike in cases predominantly in food processing, manufacturing plants, warehouses, and in delivery companies. We feel confident that we know where the root of the problem is right now and that a gradual reopening of our park amenities should, and I underline should, not pose an issue if people respect the rules by only socializing at the park with people that they live with, and most importantly, keep a safe physical distance. Fresh air and outdoor activity is important for physical and mental health. You can see I've outlined a lot of disclaimers here, and that's because, mark my words, we will not hesitate to close it all down again if people don't govern themselves accordingly and if there are flare-ups in the number of cases. With that being said, after discussion with our Chief Medical Officer of Health, we have decided to proceed with a made-in-Mississauga approach to reopening park amenities. We will not be reopening amenities at our 500 parks all at once. We will be taking a slow, phased approach, and we will be starting with individual activities that carry a lower risk. Starting Monday, June 1st, residents can once again enjoy our leash-free dog parks, our public and community tennis courts, our skate parks, our park benches, our picnic shelters, and starting as early as this weekend, all the parking lots associated with these amenities in consultation with the local councillor will begin to be reopened. We will continue to take the advice of our health experts, and we will carefully monitor compliance at our parks along with the case numbers in the coming weeks. We will not even begin to discuss dates for the rollout of the Phase 2 amenities such as our multi-sport, bocce, and basketball courts until we feel confident that with these reopenings that they are safe. As I said before, we won't hesitate to roll things back if we need to. Our goal is to move forward and to never look back. Your actions and your choices determine our path forward. You have a civic duty and a responsibility. Your rights do not trump the responsibilities of your neighbours. Please respect the rules, and we can all enjoy public spaces. It's your choice, so please choose wisely. We will also be launching our Parks Ambassador program. Starting next week, we will be redeploying full-time recreation staff that usually work in fitness, recreation, programming, our aquatics, and our community centres to patrol our parks in teams of 2. They will help educate the public on some of the smaller infractions, such as crowding and amenity closures, which will help alleviate the pressure on our enforcement staff. They will be wearing bright blue city t-shirts with the logo, and they'll be out patrolling the parks in the next few weeks. So please, if you have any questions about what's open and what's not open, please feel free to ask them. Today, Council also made the decision to extend the cancellation of permits for major festivals, events, and large gatherings in our city facilities until September 7th, 2020. Even when life returns to normal, we will not likely be encouraging large gatherings like the ones we used to see through the summer at our beautiful celebration square or in our parks. There are nearly 550 events scheduled between now and September 7th across our city. It's only fair that we provide clarity and certainty to all those planning their events in our community. This is not a decision we take lightly, and we know it will unfortunately have a huge economic impact on our tourism sector, but we believe it is the right decision in these circumstances. Should the provincial directive change and the situation improve drastically in the coming months, we will, of course, reassess this in consultation with Peel Public Health and with the province. Before I turn it over to Dr. Lowe, I want to quickly touch on the province's new testing strategy, which I understand will be released any day now. I agree we need to increase testing across the board to manage this epidemic. But we need a coordinated strategy to do so, and it will not happen overnight. Our testing centres are already overwhelmed. Any plans to ramp up testing would need to be met with the necessary resources and capacity from the province to support broader testing goals. We also need lab capacity to support Peel Health's contract tracing efforts and to properly follow up with all the tests conducted. We will continue to work with Peel Public Health and Trillium Health Partners to respond and implement the province's plan in a way that allows us to test in the right places first and get ahead of this virus. We know that enhanced and ongoing testing and contact tracing are both the keys to getting life back to normal and to manage this virus. I will now turn it over to our Chief Medical Officer of Health, Dr. Lawrence Lowe, to provide us with a brief update on Peel Region's response to the virus. Dr. Lowe?
Thank you, Madam Mayor, and good afternoon. As of noon today, Mississauga has seen 2,056 cumulative cases of COVID-19 in our community. Of these, 1,497 have recovered, and 198 Mississaugans have sadly passed away. In addition to that, there are other indicators from an enhanced indicator framework that we have begun to use at the Region of Peel Public Health. Many of you have heard of me speak to these in previous days. Most concerning is that we are seeing an increase in our 7-day moving average of new COVID-19 cases in the region of Peel. In sharing that picture and information, I want to make clear that while our picture looks different in the region of Peel, Peel Public Health continues to work closely with the Ministry of Health and our Chief Medical Officer of Health, Dr. David Williams, in responding to the COVID-19 pandemic together here in Ontario. It is now clear from the time that we have spent that the ongoing increase in cases in our community is related to workplace exposures. For that, I am grateful that Mississauga Council supported this morning my recommendation to initiate the next phase of reopening outdoor amenities in our community. I also thank Mississaugans for their patience as we sought to investigate the reasons for the increased cases in the region and the delay to reopen. From a broad perspective, outdoor spaces present a lower risk of transmission of COVID-19 if they are used in a responsible manner. And that's why I'm encouraging you now to go out and enjoy the weather, but I implore you to please do so responsibly. Do not gather or crowd in outdoor spaces. Stay 2 meters apart from people who are not in your immediate household. Wash your hands frequently and do not touch your face. And when you head inside to places where distancing is difficult, wear a non-medical mask. And finally, try to visit parks that are closer to home rather than scenic hotspots that can become viral hotspots if we aren't careful. I know many people have discussed the images of crowded parks from other jurisdictions that emerged over the past weekend. We are relying on everyone in the Peel community to do the right thing to slow the spread of COVID-19. Remember that the further up the curve we go, the longer it will take to come down. And recall as well that while the virus is unseen, the consequences of letting up are very much seen. It is seen in those who have lost loved ones to COVID-19 in our community, parents, grandparents, loved ones that are no longer with us. And we certainly think of particularly of those that have been impacted by the crisis in our long-term care homes. It is seen amongst the proprietors who have sacrificed so much to slow spread in our community, only to see our numbers grow and our timeline lengthen as they wait to reopen. And it is seen in the hard work of our healthcare workers and first responders who help patients battle every single day, and among our essential workers who, despite their fatigue, keep our community moving in these unusual times. Our decisions affect them. You can also see the risks of transmission very easily. Bringing together a large group in defiance of regulations, that's a transmission risk. Sneaking out to see your Tinder date because you're tired of quarantine Zoom, that's a transmission risk. Going to see grandma and deciding to sneak in a hug. Ignoring guidance on opening a workplace safely. It is critical as we reopen that we all take responsibility as individuals, proprietors, and community leaders doing what we need to do to stop the spread of COVID-19. As our testing and tracing continues to expand, so too will our bubbles. But our bubbles cannot expand if our cases continue to climb. So please, wash your hands regularly, stay away from crowds, stay apart while out, and wear a non-medical mask where that's not possible. And remember, as outdoor spaces open, this is not the start of open season. We cannot give COVID-19 an inch. Know the risks, know the consequences, and know that ultimately our way out of this is in all of our hands. Thank you.
Thank you, Dr. Lowe. In early April, we launched the Mississauga Challenge in support of our local food bank. Throughout these challenging times, Mississaugans have shown that we are a city that cares and we step up in the time of need. We had an ambitious goal, but our city rose to the challenge, quickly surpassing our initial goal and going above and beyond to put 2 million meals on the table for families struggling to make ends meet during this crisis. I pause here to introduce Mohammed Faki, President and CEO of Paramount Fine Foods, community philanthropist, and founder of the Mississauga Challenge, to come up and provide us with an update. Mr. Faki.
Good afternoon, ladies and gentlemen. I'm here today to let you know that Canadians have answered the call. We have wrapped our arms around those in need one more time. On April 8, we launched the Mississauga Food Bank Challenge, along with Mayor Bonnie Crombie, to raise $840,000 to support the Mississauga Food Bank. Then we found out that the food bank needed another $325,000 to support its children, senior citizens, and families to have the healthy food that they need and deserve. I'm here today to announce that we have raised over $1,200,000 in less than 7 weeks for the Mississauga food banks. It's important for me that I give a special thanks to the Mayor Bonnie Crombie for her support and her leadership. I would also like to thank everyone, all the business leaders, companies, spiritual leaders who accepted the challenge and helped us reach our goal. It's such a warm feeling when a community comes together. It's so moving when we show that whether we are citizens by birth or by choice, whether we've been citizens for decades or for days, a Canadian is a Canadian. Thank you so much for your generosity, for your support, and for being the best people in our country. I can't really express my feeling how happy I am we were able to provide those 2 million meals. So thank you again, and please stay safe.
Good afternoon. On behalf of everybody at the Mississauga Food Bank, I'd like to take a moment to acknowledge the fearless leadership of both Mayor Crombie and Mohammed Faki. Without you both, this campaign would not have been the success it is today. When we first launched the Mississauga Challenge, $840,000 was a stretch goal. But not only were we able to raise that amount in record-breaking time, but we were able to raise the bar and reach over $1.2 million to feed our hungry neighbors. But it's only thanks to support that we were able to provide food for almost 2.5 million meals to hungry kids, seniors, families, and neighbors all across Mississauga. The funds raised are already hard at work. We've distributed food in the last 8 weeks for over 500,000 meals. We've been purchasing bulk food at discounted wholesale rates. We have purchased and distributed PPE and increased our safety practices. And we have also given monetary support to organizations within our network of agencies here in the city. During these times, we've also opened an emergency food bank at our warehouse and are now serving almost 10 times the number of households in our food bank to home delivery program. I'd specifically like to thank everyone who accepted this challenge. I am so honored that over 3,000 individuals, 100 businesses, and over 30 community, religious groups, nonprofits, and foundations stepped up and pledged their support. Mississauga, my city that I live in as well, thank you for doing your part and stepping up to the plate to make sure that no one in our community during this critical period goes hungry or beyond this time. This has shown us the value that you put on food banks both now, but each and every day year-round. And to those of you who need food because you have financial challenges right now, the Mississauga Food Bank is here for you, and there's no shame in reaching out to ask for help. So please visit our website and we'll make sure to help you find the agency closest to where you live. I'll pass things back to Mayor Crombie.
Thank you, Megan. I'm really overwhelmed at the outpouring of generosity that we have seen across our city from residents, and from members of the business community as well. It's truly unbelievable, and from the bottom of my heart, I want to thank everyone who helped us reach our campaign goal and even our extended goal. Know, however, that there is always a need here in our city, and if you have the means, please continue to support our food bank on an ongoing basis. I want to close by once again thanking our residents for their patience and for their understanding. I know these past few months have not been easy for anyone. Let's continue to make the right choices, look out for each other, and never lose sight of our common goal to keep our city healthy and safe, and to ensure that we never have to do this again. That includes wearing a non-medical mask in situations where physical distancing is not possible, such as on our transit buses. We highly encourage anyone taking MyWay Transit to please add this extra layer of protection to help reduce the spread of the virus. Thank you, and I will now take questions from the media.
Mayor Crombie, your first question comes from Jonah Shinuda from Mississauga. Jonah, please go ahead.
For Mayor Crombie.
Welcome, Jonah.
Hello, can you hear me?
Yes, we can.
Hi, my first question is for Mayor Crombie.
Sure.
Just wanted to know, when do you think the city will move forward on opening up more lanes for cyclists and pedestrians?
It's a very good question. It is one we're actively pursuing. In fact, this concept came up again in our council meetings today. As you know, that we do have lanes available for active transportation right in our downtown core and in many wards right across the city. And of course, the councillors are asking our public transportation and works department to consider opening up even more each week.
Great, thank you. And my next question is for Dr. Lowe.
Thank you.
Just wanted to ask, how is the region of Peel doing with contact tracing, and does the region need more help or volunteers in this area?
So thank you for the question. At this time, Peel Public Health is meeting the provincial target of initiating contact tracing investigations on over 90% of cases within 24 hours. However, as I said in my remarks, this speaks to the need for all of us to ensure that there is a continuing decline in cases. If we start to see a surge in cases, that capacity could very quickly be overwhelmed. And it is for that reason that we are also actively looking at bringing as many people on board through hiring and through redeployments in the weeks to come, just in preparation of that. But at this time, we are meeting provincial standards and targets. Thank you for the question.
Mayor Crombie, your next question comes from Isaac Callan from The Pointer. Isaac, please go ahead.
Hi, Mayor Crombie. As Dr. Lowe said, there's a reduced chance of transmission outside in parks, but there's obviously still a danger. Has the city thought about any sort of physical elements in parks to help ensure physical distancing, things like the circles that you see in parks in New York and measures like that?
So we have had that discussion. Thank you very much for that question. And we don't see that kind of sunbathing that occurred in Trinity Bellwoods and in New York that you see in Mississauga parks. Mostly families are using the walkways and trails and paths for exercise. So it has been considered, but it would be very onerous on the staff, and it's not something that we're doing at this time.
Thank you. And then my follow-up maybe for you or Dr. Lowe, so I'll ask it, and then if you think it's more suited to him, pass it over. It's just the idea that increased cases are coming from the workplace in Peel, but there's a danger, obviously, that they could then spread in the community in settings like parks. So how is the enhanced framework going to measure in real time the danger that workplace transmission is becoming community transmission over the next couple of weeks?
Yeah, so I'm certainly going to allow Dr. Lowe to respond to that. Right now, the concern is household clusters that have been infected, and largely we feel that that's a result of the openings, the loosening of the economy we saw past week and a half ago with the Main Street retail opening, as well as the garden shops and the hardware stores, et cetera. But certainly in the reopening of some of the manufacturing outlets, the logistics companies, the trucking companies, food processing, et cetera, we have to ensure that there are safeguards in place at workplaces to ensure that people are proper distancing and taking precautions such as wearing masks and using proper hand sanitization, proper hygiene and sanitization, because the risk of obviously has increased. So they are bringing the virus home with them from work, and we see the increase in household clusters right across Peel. And Dr. Lowe, perhaps you want to respond as well.
So thank you, Madam Mayor, and thank you, Isaac, for the question. In fact, Mayor Crombie has it exactly right. The way to avoid workplace exposures from becoming broader community transmission is twofold. It really speaks to the ongoing work that our investigative teams are doing in workplaces to identify cases and contacts, direct isolation, but it's also speaking to the need for the community, as I said, to continue taking those critical measures and precautions, to physically distance, to wear a non-medical mask in settings where you can't, because that will also ensure that the risk of transmission in the community is low. And I will also state here as well, in the course of all our investigations, if there was ever a risk to the public more broadly identified in any cluster, then we would certainly advise the public as well, just so that they can take requisite precautions. So thank you very much for the question.
Mayor Crombie, your next question comes from Steve Cornwell from Mississauga News. Steve, please go ahead.
Hi, Mayor Crombie.
Hi, Steve.
It's a question around testing. I know you spoke a little bit about it in your opening to the presser today. Brampton has put out a release asking or kind of encouraging all staff of the city to get tested for COVID-19. Why is Mississauga not doing something like that in a similar way?
Well, certainly we are encouraging testing, but we all are following the protocols laid out by the Premier and also by Dr. Lowe, our Peel officer, medical officer of health. Certainly we are following targeting testing. Of course, those with COVID symptoms should be tested. Asymptomatic people who are essential frontline workers, including our police, firefighters, paramedics, even our transit drivers for that matter, those frontline workers that could potentially be exposed to the virus. And then there's those non-symptomatic people who feel that they could have been exposed through community transmission or in their household as well. Those are the people we are encouraging, very targeted testing. Our testing will be very targeted to assure that those people who are at greatest risk are tested first. There is a capacity issue in the system, and we're waiting to hear from the Premier what they will do, what the plan is from the province to increase our testing capacity, because as it is to date, I believe yesterday we had 1,100 tests done in William Osler in Brampton, about 800 or 900 at Trillium Health Partners in Mississauga. So you can see that if if all the police officers actually went in to be tested, it would drain the capacity in the system for everyone else. So we're waiting to hear how that will be done correctly, very strategically, and perhaps the best method of doing it is one of those mobile testing units to actually physically come to the sites at police headquarters or paramedic stations, etc. Maybe Dr. Lowe would like to respond to that as well. But certainly we are taking a similar approach, but we're encouraging those who are at higher risk, as outlined in the protocol, to come out first.
Steve, thanks for the question. Mayor Crombie is correct. I think Ontario Health has put out very clear criteria that have been outlined, and really just given the idea that we want to be going where the fire is, and we are all for testing more, but it's also not just testing more, but it's testing more of the right people. That will allow us to identify potential chains of transmission, as well as populations that are either at risk of contracting the virus or spreading it to other people, and that really speaks to a lot of the workers there. And I for one, will be very curious to see, and am very excited to see what the provincial testing strategy will look like once it is released, and what the implications will be for us in the region of Peel.
Great. And just follow up on the care situation. The province is reportedly taking over management of that facility. I'm just curious, from first as kind of just a brass tacks technical description, what does that mean as far as Peel Public Health
Sure, I'll let
concerned?
Dr. Lowe respond. Sure.
Sorry about that.
Thank you, Madam Mayor. Thank you, Steve, for the question. Peel Public Health was just advised of this through the Premier's announcement as well. In terms of our involvement with the long-term care homes, as you know, we have worked with Ontario Health and the hospital and healthcare partners and the long-term care home administrations in terms of a broad set of pieces around personal protective equipment, staffing, outbreak control, testing, etc. The pieces that Peel Public Health has been most involved in has been around directing outbreak management, as well as directing testing in the course of that management, and also supporting with infection prevention and control. So it's not. So in terms of our specific role, we will continue to wait and see how that impacts us. But I imagine if you have questions around staffing, personal protective equipment, all those other pieces, and I really do think the taking over piece may relate more to staffing and leadership. You may be best directed to have that question directed to Ontario Health, who leads that part of the coordinated strategy. Thank you for the question.
Mayor Crombie, your next question comes from Tina Yazdiani from City News. Tina, please go ahead.
Hi, this question is for Dr. Lowe. I was hoping you could comment on reports that you had called on the province to take a regional approach to reopening, meaning harder hit areas like Peel should keep strict restrictions in place while others maybe should lift them. Can you elaborate?
Yeah, thank you, Tina, for the question. I'm also going to let Mayor Crombie speak to this. And as I said at the outset of my remarks, there is a recognition that we have seen a different picture of the pandemic here in Peel, particularly as our 7-day moving average of new cases is on an upward trend, which is not where you want to be going with reopening. But I want to be very clear that we also recognize, at least at Peel Public Health, that the province has a very difficult challenge in balancing the pandemic picture between what we're dealing with here in Peel and with other parts of the province as well. And we certainly continue to work collaboratively with Dr. David Williams and the Ministry of Health and Long-Term Care and our provincial partners to come up with advice and metrics and indicators around reopening that make sense and that allow us to inform our community leaders as well as the public as to where things are at. And I'll pass it over to Mayor Crombie. I'm sure she'll have additional comments.
Thank you for the question, Tina. I think you'll recall it was about 3 weeks ago that we asked the Premier, I asked him specifically on a phone call that I had with him, as well as some other ministers, to allow us to take a regional approach. And he opted to take kind of a pan-Ontario approach, which we knew wouldn't be appropriate for us because we had not yet peaked. We had not yet seen the plateau. We were not seeing any declining numbers. And so we were very concerned about reopening too quickly, and we wanted a very unique approach, a regional approach, to be applied in Peel. As we had seen in Alberta with Calgary, in Quebec with Montreal, in New York City as well, we thought it'd be very appropriate that we have our own unique approach to reopening. And as you saw last week, we did not go forward opening a number of the park amenities that other cities chose to open. We wanted to heed the advice of our medical officer of health, who said, let's proceed slowly. Let me better understand where the clusters of new infection are before we begin the reopening. So we waited an additional week until we better understood the issues and where the virus was being targeted and to begin the reopening phase.
Just to follow up on that, as you said, you Mississauga decided on its own not to reopen parks last week, and the Premier actually commented on this earlier, saying it's up to the 34 medical officers of health to make those decisions for their own region. So I guess, why do you think the directive should come from even higher up? Do you think this is a communications issue that the public might get confused if it's an Ontario-wide directive?
Yes, certainly. So let me just clarify as well that all parks remained open at all times. It was the amenities in the parks that remained closed and our parking lots. Certainly it would have caused confusion, and that's why we thought if the Premier announced that a regional approach would be taken right across the GTHA, it would have caused less confusion among residents, because certainly it did. Perhaps it was a communications issue between ourselves and Queen's Park. But the Premier was aware that we wanted to take a regional approach, but I think in whatever advice he received from his medical officer of health, because I know he follows the advice of Dr. Williams, much the way I follow the advice of Dr. Lawrence Lowe, that they decided to take a pan-Ontario approach. And we, in the only authority and powers that we have under Section 22 and Section 13, Dr. Lawrence Lowe invoked those, allowing us to take a slower approach, an asymmetrical approach here in Peel. I don't know if Dr. Lowe wants to comment.
Thank you. And just to clarify, Madam Mayor, so we didn't necessarily invoke the use of Section 13 and 22 in respect of the specific park opening pieces, but it was on my strong recommendation that I had identified that the picture that we had here in Peel was different from the rest of the province, certainly from, more aligned with other health units in the Greater Toronto Area. And as I've said, before, certainly we are always in constant communication and working with, Dr. Williams and the Ministry of Health and Ministry of Health in trying to respond to the pandemic as makes sense both for the province of Ontario, but also respecting the local epidemiology that we see. And that's part and parcel of the challenge and the balance that we find ourselves here, at least in Peel, where our picture is very different from the rest of Ontario.
Tina, it's Mayor Crombie. I just wanted to add that, at the time these openings were announced, we were still seeing increased cases each and every day, fluctuating from 100 new cases to 11 new cases, averaging around 35 new cases. While at the same time, there were communities right across Ontario that were COVID-free or having minimal amounts of infection, new cases, or no new cases each day. I know Kingston, I think, was COVID-free, and Niagara had, 4 cases, I believe. Right, so there was just a difference in experience right across the province.
Mayor Crombie, your last question comes from Khalid Salama from My Second Home TV. Khalid, please go ahead.
Hi, Mayor. How many long-term care homes in Mississauga, and has inspection procedures changed following yesterday's findings and the report by the military?
Is it 15? Right. So there are 15 long-term care homes, I think. Yeah. There's approximately 15 long-term care homes, but the protocols and procedures are under the Ministry of Long-Term Care, so it is not something that is under our purview.
I see. And my follow-up question for Dr. Lowe, please.
Sure.
Hi, thanks. Yes.
Hi, Dr. Lowe. And Mississauga, do we have COVID hotspots compared with those in Brampton you mentioned earlier today?
So just to clarify, I think I mentioned that geographic data, at least in Brampton, as well as in Mississauga, has its potential usefulness, but is but one source of data in terms of assessing the picture of the pandemic and the risk in our community. So specific to what we see in Mississauga, our focus has really been on the workplace exposures that have been identified and the various household clusters. We try to caveat that geographic clusters or geographic data has some limitations. So for example, a lot of the times if it's linked to testing data, it only speaks to where the person may live as opposed to where they may have gotten exposed. And related to that as well, we know there are no invisible walls within our community, and the reality is that people who may be transmitting COVID circulate throughout our community and are not necessarily confined to one neighborhood or one geographic area. So I think specific to the question of how our geographic data looks like in Mississauga. We're actively looking at this question for Peel Public Health, but at this time it doesn't necessarily change our advice, which is really that people should be sticking to those precautions and taking responsibility in the manner that I described: distancing, hygiene, non-medical masks, and avoiding crowds wherever they may be going in our community. Thank you very much for the question.
Thank you, Dr. Lowe and Mayor Crombie. This concludes today's press conference. On behalf of the Mayor, I want to thank everyone for participating. Our media team will be sharing a link to today's press conference with you shortly. Thanks so much again. Have a great day and stay well.
Thank you very much.